Diagnosis according to 4 levels. We discuss damp heat. Dampness and heat can bind together and are difficult to separate. Invasions of damp heat often occur in the summer when the weather is rainy and in humid and hot climates. There is often an underlying spleen dampness. It is also mainly the functioning of the stomach and spleen that is disturbed when there are invasions of damp heat. The way that the symptoms manifest will be influenced by whether it is dampness or heat that is the predominant pathogen. There can be a fever that is most noticeable in the afternoon. This is explained by dampness being a yin form of pathogenic qi, and yin is on the increase afternoon. When the yin dampness contains pathogenic heat, the pathogenic heat will increase together with yin in the afternoon. The heat will often cause the person to sweat. This will temporarily relieve the fever, but the fever will soon return. The person will often find that the fever comes in waves. Dampness blocks the movement of qi, creating a sensation of heaviness. This will be most apparent in the limbs. The heat aspect will make the muscles feel sore and ache. The stomach and spleen qi mechanism will be blocked by the dampness. This can result in nausea and the loss of appetite. There will also be diarrhea that is odorous and sticky. The heat can cause a stinging or burning sensation in the rectum during and after bowel movements. Dampness can also block qi in the upper jaw, resulting in chest oppression. The heat-yang dynamic can ascend the yin dampness to the head. At the same time, dampness can itself block the ascent of clear yang to the head. This will result in a heavy headache and a difficulty in thinking clearly. The heat will cause the headache to be pounding or throbbing in nature. Damp heat will be seen in the complexion, which can be yellowish. The skin and the sweat can be oily. Restlessness and irritability will arise if the heat aspect agitates the shen. Etiology: exposure to exogenous pathogenic qi that has either invaded the qi level directly or penetrated down from the wei level. Symptoms and signs: fever that is reduced by sweating but soon rises again. Fever that is worse in the afternoon and comes in waves. Heavy and aching muscles, especially in the limbs. Nausea, poor appetite, loose, sticky, odorous stools. Chest oppression. Heavy and possibly pounding headache. Difficulty in thinking clearly, oily skin, yellowish complexion, restlessness or irritability, red tongue with yellow sticky coating, rapid and slippery pulse. Key symptoms are odorous diarrhea, fever, yellowish greasy tongue coating, rapid and slippery pulse. Treatment principle: drain damp heat. We can choose from DO 14, LI 11, stomach 25, stomach 44, spleen 9, spleen 6, and REN 12. Needle technique: draining. DO 14 and LI 11 drain qi level heat. Stomach 25 and stomach 44 drain damp heat from the intestines. Spleen 6 and spleen 9 drain damp heat. REN 12 drains dampness from the middle jaw. The person must avoid consuming foods that produce dampness or heat. Damp heat can be caused by wei level heat and can result in yin level heat, blood level heat, and spleen qi deficiency. Thank you for your attention.